Okay, so digestive system disorders. So first thing we look at is emesis. Emesis is vomiting. Really, vomiting comes from here, okay? So we have receptors in the brain that are stimulated, and that's what causes reverse peristalsis and vomiting, relaxation of the lower esophageal sphincter, and it can come out. The problem with vomiting is you lose a lot of things. So potassium, you can have arrhythmias. Acid base, you're going to lose a lot of acid. So now they're going to become alkalotic. Okay, water, you're losing fluids, and then chloride ions. So more abnormalities, metabolic abnormalities that can be seen. So vomiting, we try and stop it. The only time you should allow vomiting is like if someone has food poisoning, to try and get the poison out. Sometimes we'll induce it to get rid of, like if someone tries to overdose on certain things. But certain things you shouldn't. Like if someone consumes like an acid, for example, we don't want them vomiting. It's just going to tear things up more. You see extreme cases of vomiting with like anorexia, bulimia, and it destroys their teeth, the mucosa lining of the esophagus, and they tend to have like burns on their fingers from the acid, and that can be a sign. So one of the wonder drugs is Zofran. It's a 5-HT inhibitor. Great drug. Something if you get a prescription for it, keep it tucked away for the rainy day kind of thing. There are some, quick dissolving stuff like that. Pretty safe for the most part, but a good medication to have around, or when someone having extreme vomiting that we want to stop. Constipation. So really, GI pain, the number one causation is constipation. And the number one reason for this is lack of fluid intake, water intake specifically. Hydration is important. Beyond that, we need a fiber. So there's soluble and insoluble fiber. So you get this in a lot of different foods. It helps things move along. It feeds your microbiota. So it's really, really important to have that. Constipation leads to hemorrhoids. You can actually rupture GI lining. Fiber is important. Water is important. And while we're looking at this, you see like fruits on here, okay? Fruit is good when you don't juice it. Don't drink juice, people. That is just sugar water. There's no value in juice, all right? Eat the whole fruit. It's excessive calories, and you're not getting the fiber. The pulp is what's the fiber, okay? So eat the orange. Don't drink the orange juice. And, to put it into perspective, you look up how much calories are in an orange, okay? That's really the juice is what you're looking at, or a cup of juice, how many calories. And then think about if you ever made orange juice, how many oranges it took to make that orange juice. It's an absurd amount, okay? And people will say like 6-7 oranges to make a cup of juice. That's crazy. Eat the oranges, all right? Diarrhea. Lots of causations for diarrhea. Diarrhea can be a protective mechanism. We are trying to get rid of an infection. Or it can be due to like enzyme deficiency, so like lactose intolerance, because that solute is in there, water follows. Diarrhea really is defined by a volume, or you can say number of times a day, quite a few times a day. And the problem here is they start to lose a lot of bicarb. So they can become acidotic. You are losing volume. So you can have arrhythmias. Like I have SVT, supraventricular tachycardia. And if I get dehydrated, diarrhea, if I get bout of diarrhea, it will typically trigger my SVT if it's severe enough. So that's something, you'd be mindful of. And then, heat stroke because you're dehydrated, you're out in the sun because you're having diarrhea. So something to be mindful of. You don't want to stop diarrhea unless they are being overly dehydrated. It's more important to rehydrate. Just give them fluids. Let them flush out the toxin or whatever is causing it. If you give them Imodium, you plug them up, now the bacteria is just festering in there, okay? Steatorrhea, this you really see, post gallbladder removal. That's really where you start to talk about that. That's the fat in the feces. There's certain infections that can trigger this as well, like Giardia, that little bugger. The fat isn't reabsorbed and comes out in the stool floats. That is a sign that someone is having fatty diarrhea. And then my all-time favorite is sugar-free products that are sweet. So like you guys can look it up. Look up the sugar-free gummy bears and read the reviews. They are hilarious, okay? All it is, it's like a disaccharide that we do not possess the enzyme to break down. It's the same thing as lactase deficiency. And so you eat these gummy bears and you get diarrhea. And I'm a dummy because I knew this. My wife and I decided, we're bored. It was like pandemic. Let's try keto. We were bored. And I was like, oh, I can eat all the steak I want. This is great, right? And deviled eggs is phenomenal. It's not a good diet, okay? But I have a sweet tooth. So I got the gummy bears. And I did not control myself and ate the whole bag. And I spent like 3.5 hours in the bathroom afterwards. I had to share that. All right. Flatulence, GI pain, so gas. We produce a decent amount, and really it's the bacteria. They're fermenting as they eat certain things. So some things can be bigger triggers, and that's what patients need to avoid sometimes if they're having excess flatulence. Okay. Bleeding. So hematemesis. This is vomiting blood. Okay. Hematochezia. This is in the stool. This is like bright red blood. And then melena it's in the upper GI tract where there is acid. And so the stool, when it comes out, is dark. And the reason is it's oxidizing the hemoglobin. And so it's rusting. And that's why it's dark. And it tends to be kind of sticky, pretty foul. So it's important because when we see bright red blood being vomited, we think they have esophageal tear, esophageal varices, something is going on up top, okay, in the esophagus typically. Hematochezia, hemorrhoids, bright red blood, you think hemorrhoids. If there's pain, external hemorrhoids. If it's no pain, it's internal hemorrhoids or cancer, okay? Ulcerative colitis as well, Crohn's, it has to be investigated. If someone has bloody stool, they must get a colonoscopy. Ignoring it is not wise, okay? I remember a case, I was on GI rotation, and younger lady came in. I mean, her kid was with her and her husband, and the kid must have been like 4, 5. Came in, she had bleeding in her stool, like blood in her stool, and she ignored it for a long period of time. Finally came in, got the colonoscopy, and I mean, she must have been in her 30s at best, I would say. And I remember my preceptor came over after the procedure, and he's like, she's not going to make it. He could tell. The cancer was extremely excessive, and he could tell it had already metastasized probably from the band amount, or like the bandwidth of how much was covered in the colon. So important to get it checked out, okay? And then your upper GI bleeds, once again, it could be cancer, it could be stomach cancer, it could be H. pylori, it could be just an ulcer, it could be a duodenal ulcer, a peptic ulcer, must be investigated, okay? So typically what they'll do here is endoscopy, okay? So they'll go in through the mouth and look. Motility disorders, so we're having movement issues, moving the food. So typically we talk about like stricture, so Schatzky ring, esophageal stricture. One of the, these can be genetic, okay? So what they're doing is a barium swallow here and it's getting stuck, also referred to as achalasia, when they have trouble swallow, or bird's beak, the image back here, because it's just pinched down. It could be caused by, here's bird's beak also. It could also be caused by consumption of lye, L-Y-E, okay? Not lying, right? They're consuming all the lies in the world. Lye, L-Y-E, it used to be in back in the day in a lot of like household cleaners and like hair straighteners, stuff like that. And people used to try and take it to like overdose. So they got rid of it because it would create these strictures that they would have to deal with. It basically causes like a chemical burn. I saw a case where guy came in, he couldn't swallow food anymore. It had progressed to that point and he was starting to have difficulty even with liquids. It was that tight. And his mom had the same exact scenario, and it was food allergies. And because of mast cells migrating there, releasing their granules, all of that, it just caused this chronic inflammation to the point where his esophagus was closing up. So we had to balloon it. Okay. All right. So dysphagia is pain with swallowing. Okay. GERD. Really, this is GERD, gastroesophageal reflux disease. So what's happening here is the lower esophageal sphincter is not closing like it should, and so acid is migrating up into the esophagus. It's pretty darn common. I have it. I've had it for years. So I take Nexium or esomeprazole daily. I have to. If I don't, I'm going to develop Barrett's esophagus. Barrett's esophagus is because of this repeat hit with the acid, you start to get cells to change over. They become more glandular in the esophagus to try and deal with it, and eventually you get it's either proximal or distal adenocarcinoma of the esophagus. Okay, you don't want that, right? So Nexium daily, that's the best thing you can do. A sign that someone has this is like, I used to get heartburn, whatever, and like it was to the point like at one point where if I bent over to pick up something, like I'd reflux. Okay, I was avoiding all red sauces. I couldn't eat pizza, spaghetti, alcohol, caffeine would light me up. I mean, no way. Like spicy, until I got on the medication, I got on the appropriate dose, and it's much, much better. And really, you can surgically correct the lower esophageal sphincter, but you ask a GI specialist and they don't recommend it because they tighten it up. It's too tight. They have to go back in. You got to balloon it. It's just not worth it. Just take the med and move on with your life kind of situation. The only downside to it is it causes magnesium deficiency, so you got to take a multivitamin. Otherwise, you get wicked Charlie horses, okay? I would just like basically barely move, and it's like, oh, pulled something, like the old man style, right? Don't hate. I'm getting old. I know. Hey, my wife reminds me on the reg. It happens. Anywho, yeah, Nexium, great. Over the counter, you can get it, whatever. If you need to take it, actually get your provider to prescribe it for you, and your insurance covers it, and it's a whole lot cheaper than buying it over the counter. Okay. So one of the other big signs is coughing at night. That is a sign, or someone that's constantly doing one of these. That is because there's excess glandular material in there, and there's a lot of mucus, and it's like plugging them up. They don't feel good, so they're clearing their throat. The coughing at night is because the acidic vapor is coming up, and you're breathing it in, and it's irritating your lungs. They'll use pillows at night to elevate themselves, stuff like that. Those are signs that someone has reflux or GERD, okay? Hernias, there's all kinds of different hernias, but we're just looking at like two here. So really the hiatal hernia here, so this is traveling through the esophagus, through the diaphragm. An excess amount of stomach is coming in here. It can pinch, it can cause GERD, okay? There's like sliding hernias, and then I'm pretty sure the one, I can't see it on my screen now. This hernia over here, there's probably a genetic malformation in the diaphragm, and there is intestines seeping up through the diaphragm here. Okay, so hiatal, you think at the hiatus, the opening of the diaphragm, and then diaphragmatic hernias are elsewhere. They have to be surgically corrected. Both of these do. You can actually tighten down on the organ too much, cut off blood supply, and get necrosis of tissue, so it has to be treated. Okay, did I cover? Yeah. Okay, this is the wall. Okay, so this is where someone feels something and they can push it back in. These are ultra dangerous. They need to be surgically corrected because these ventral hernias can cause constrictions again. And so this part can die off and become necrotic. And then we're going to look at a couple others here as we go through. So here's that ventral hernia, okay? Common through the femoral canal, I think, or inguinal canal, especially with pregnancy and obesity. Needs to be treated, okay? Needs to be treated. Intussusception, this is commonly seen in young children. So it's folded in on itself. You're looking down the tube. You see the rings? So they tend to have like this jelly-like stool. That is a sign. They have to resect this part of the colon. So typically it's the small colon slipping into the large colon at the ileum, or the ileocecal valve space. Okay. Volvulus, kidney bean sign. Okay, that's like one of the notorious ways to state it. The intestine twists on itself. If you, with like dogs, it's common with the dogs with the high like belly. That is common. Horses, stuff like that, they'll develop it. When it twists on itself, it has to be removed. It's necrotic at that point. Okay? And the bacteria is festering in there, and it's swelling, and it can rupture. All right. Let me see something. Yeah. Okay. Gastritis. So gastritis is irritation of the stomach lining. So typically the big causation is taking NSAIDs without eating food. So that is your Motrin, ibuprofen, Aleve, naproxen, all that good stuff. Okay. They take a 2-week regimen of Nexium and they're fine. Okay. Alcohol can be another trigger, and H. pylori. So they have to be worked up for H. pylori. Ulcers. So there are 2 types of ulcers, duodenal and peptic. So peptic ulcers are in the stomach lining. They hurt. They hurt like crazy when you eat. And the reason being, you secrete more acid. So you start thinking about food, stuff like that. Your stomach starts to produce more acid. It starts growling. That's because it's moving, it's churning. And that acid just eats away at it, okay? So we have this mucosal lining, and we have mucus on it, and that helps protect us. The problem is when it starts to erode. So here, this true ulcer, this is very painful. And as it gets deeper and deeper and it gets into submucosa, that's when you get the bleeding ulcer. And then if it gets through here, okay, we get through all the tunica muscularis, now it's a perforated ulcer, okay? That is a big problem. That is a medical emergency we need to deal with, because now bacteria and acid and food is all going into your abdomen, and you're going to get one wicked infection, okay? Duodenal ulcers, they're in the duodenum. They actually feel better when the patient eats, because they start to secrete bicarb, right? And more mucus, and it covers and coats them, and it feels good, and it negates the acidity of the stomach contents that are coming in, and so they feel good. So kind of a primitive way of diagnosing which type of ulcer people have is, have they had weight loss or weight gain? If they had weight loss, it's peptic. If they had weight gain, duodenal, okay? Both of these would cause melena. If there's blood entering, and because of the acid, it's oxidized, and so they get the black stool. Okay. Hematochezia, not probable. It's possible a little bit if they vomit with a peptic ulcer that you see it, but in reality, it should just be melena. And then there's stress ulcers, which are called curling or Cushing ulcers. So this is typically due to cortisol effect, and we can see it in these different situations. And so it's a prevention of mucus secretion is what's the effect there. All right. Pneumoperitoneum. So this is air inside the peritoneum. So you can see this gap right here. It shouldn't be there. And you can see it here. Okay? The diaphragm above it and stomach contents. And there's an air pocket. Typically perforated ulcer. Laparoscopy, they can puncture on accident or injury. Like something traumatic, stabbing, something like that, gunshot wound, all kinds of situations there. Bile. Okay, liver makes bile. Bile is secreted through the left and right hepatic ducts, which combine into the common hepatic duct, and then would flow down the common bile duct and out the ampulla of Vater into the duodenum. If you're not eating, there is a sphincter here. It closes, it backs up, it goes through the cystic duct, and then it goes into the gallbladder. The gallbladder then concentrates the bile. So it's pulling the water out, and it's just making it like a stronger detergent, if you will. It's concentrated soap, essentially. Okay, so that's why you can remove the gallbladder and you're fine, because liver is what's making it and secreting it. As far as bile goes and fat, when we secrete it, we do pull a lot back in. So about 95% is reabsorbed. We recycle it, we use it. And this can also affect bilirubin levels. Okay, so if there's too much we're not secreting it and it builds up in the bloodstream, that bilirubin then causes the jaundice that we would see. Or if there's a stone occluding it, any of that could cause that situation. Cancer. Okay? Malabsorption versus maldigestion. Maldigestion, you can't break the food down. So you talk about diseases like cystic fibrosis, because the pancreas is obstructed, they can't secrete out the enzymes, can't break down the food, you can't absorb the food. Lactase deficiency, you can't break down lactose, you can't absorb it, it's too big. And then there are malabsorption, so there's something wrong with the surface of the small intestines. So this is where you start to talk about Crohn's, celiac, ulcerative colitis, all of that. So celiac disease, this population is allergic to gluten. No one else is. Okay? There is a very big misconception with this, all right? People that have true celiac disease lose weight like crazy. They have diarrhea, not constipation. So a lot of people you hear like, oh yeah, gluten, it just, bloats me and backs me up, or, any of that. Nope, you do not have a gluten allergy, okay? You have a diet allergy. Oh, yeah, that's... Anywho, so there's blunting of the villi is what happens. So you have these little fingers in your intestine, and it increases contact point, okay, so that we can absorb. Well, in them, it blunts. It goes down, and it slides straight through at that point. In all my years, with my medical knowledge, I think I've come across 3 actual celiac disease cases that I know of. It is not as common as the food industry is leading you to believe, okay? So in like children, they'll have failure to thrive. They are shrinking, dwindling, weak, okay? There are some rashes people will develop, and that can be a sign that they have celiac, but for the most part, most people don't. Irritable bowel disease, so Crohn's is the first one we look at. Crohn's, autoimmune, they have what is called cobblestoning, okay? So you can see in like pseudopolyps. They can end up having to have parts resected because of obstruction. Not a fun disease to live with, okay? They tend to go on diets not high in fiber because it gets stuck, and so not healthy at that point, right? Ulcerative colitis, you see, so this one's even worse. Here, this can go mouth to anus. Anywhere along there, they tend to have a lot of bleeding. Cancer risk is increased. And both of these develop in like your 20s, okay? I put a chart in here so you guys can do a little comparison, run through it, right? And here, so in UC, they have what is called lead pipe when they do a barium swallow, because it's like these just solid areas. And then string sign and Crohn's, so it looks like these little punched in areas. Sometimes they'll refer to it as thumbprint sign too, because it looks like little thumbprints, right? Yeah, it's not anything you do, it's just autoimmune, you and your luck, right? Irritable bowel syndrome, or IBS. This is not IBD. So here, there's 2 versions. There's IBS-C and IBS-D. It used to just be, you get diarrhea or constipation and you flip back and forth. But there are some populations that just get one, okay? Constant constipation or constant diarrhea. And we don't really know what triggers it. There's a lot of thought out there. It could be like a gut brain axis disorder, something, an infection they got at some point. It disrupted all the normal flora. So like they had like a C. diff infection flare up, something like that. Excessive antibiotic use, diet in general can affect this. So this is where your good, clean, healthy diet comes into play. It can make a big difference for these patients. And sometimes they can do fecal transplants. That's always a fun one. So fun fact, fecal transplant, basically they insert feces into your rectum to transplant it, and they get it from a family member because you and your household members all share the same bacteria. It's a pretty shitty job someone has to do. I know. Diverticulosis. So diverticulosis, this is what happens when you have a low fiber diet. You get this outpouching, okay, in your colon. So that's what all these little like balloon little structures, okay, little pockets. So as we get older, we tend to see it more, and eventually can lead to diverticulitis, okay. So what happens is this little outpouched area gets obstructed with feces, and it festers and it ruptures, and you got to take out part of the colon. It's an emergency surgery that needs to be done. So high fiber diet, very important. Low fat, we don't want that residual in there packing and pushing. Hydration is important. Constipation could be a trigger for this as well. Appendicitis. So appendicitis, it's decently common, okay? Step one now is treat with antibiotics. We want to get you in there as quickly as possible, identify it, treat with antibiotics. The problem is it's once again, it's kind of like that diverticulitis. Like it gets occluded. So here's your appendix. It gets occluded and it starts to fester in there. Okay, so the appendix hangs off here. You can see it here. You can see it here with the fecalith in there, just festering. So they used to just go straight in and remove the appendix, do an appendectomy. Appendicitis. Oh my lord, appendectomy. Okay, it's just tongue twister. But now they have found, give you IV antibiotics, fluids, no food, and they can usually clear it. You don't want to do surgery unless you have to do surgery. No anesthesia is safe anesthesia in reality. Like general anesthesia, no such thing, okay? It's as safe as we can make it, but in reality, it's still dangerous. And, appendix, they have found it does play a role like in our immune system, so not the best thing to get rid of it if we don't have to. Someone I know just recently, older gentleman, and it happened to him, and they had to remove his. His was on the verge of rupturing. He waited too long before going in. He could have had some antibiotics. Instead, he had surgery. So, listen to your body, people. Jaundice, so really it could be a causation before the liver, so prehepatic. This would be like something is causing the red blood cells to randomly lyse, mechanically lyse, or like thalassemia major, they're lysing, in 60 days instead of living the 120, there's excess bilirubin. Intrahepatic, this is going to be liver failure, okay? Or something's wrong with the liver, and it can't conjugate the bilirubin. So like cirrhosis, for example. And then post-hepatic, this is an obstruction like a stone, cancer, something like that. And so it can't secrete it out. So the problem with this bilirubin, this unconjugated bilirubin, deposits in the skin, deposits in the whites of the eyes, and there's the jaundice. In newborns, it would deposit in the brain and can damage the brain, and they tend to be itchy. Okay, that is a sign. Portal hypertension. So the portal system basically is veins between certain areas going into the liver. So really it's draining the esophagus, it's draining the spleen, stomach, kidney, intestines, all of that travels through the liver. So if you block the liver, pressure increases in all those systems. They dilate. So what happens? We get esophageal varices that can rupture. Splenomegaly, spleen can rupture. Ascites, this is fluid buildup in the abdomen because the excess pressure in there, we can't reabsorb the fluid, the blood. It has to be drained. They can develop spontaneous peritonitis. They basically get a bacterial infection out of nowhere. And really what it is, it's coming from the gut. All the swelling in the intestinal lining, all of that, and the bacteria can start to squeeze out. And then hepatic encephalopathy. Basically, they're not processing ammonia, and it builds up in the brain. They shut down. They pass away. Right? Fatty liver disease. Really, here in the States, non-alcoholic fatty liver disease is becoming a huge, huge issue. So all these little white bubbles, that's fat. It causes cirrhosis in the end. Okay? Alcoholic fatty liver disease is common to an extent. The pandemic pumped those numbers up, that's for sure. The amount of abuse during the pandemic, they were talking about it was like a 40% increase in alcohol and drug abuse during the pandemic. So you guys are going to see that as healthcare workers when you get out there. They'll be rolling in at that point. You ever heard of skinny fat? People with poor diets, but they're real skinny, and they'll have non-alcoholic fatty liver disease. So diet is important. Excess calories, we deposit as fat. We deposit everywhere, every organ, around organs, under your skin, everywhere. The liver, it deposits in it, and it causes dysfunction. Okay. Liver cirrhosis, alcohol, hepatitis, Hep B, Hep C, ciliary cirrhosis. So all end result is the same thing. AST, ALT, which are the enzymes in the liver, skyrocket in the bloodstream because it is reacting to it. And then eventually plummet because there's no more hepatocytes, and we get all the fun stuff after that. So, and when you look at cirrhosis, there are all kinds of symptoms. It affects all areas of the body. Okay, so like bleeding risk because you're not making clotting factors. Hypoalbuminemia, so low albumin. So you're not transporting fats around like you should. You are losing that osmotic oncotic pressure. So there's ascites because of the increased portal pressure because things aren't flowing through. Dilated veins, that's that spider angiomata. So you'll press on them, they'll disappear, and they come right back. Gynecomastia in males, so male breast tissue because testicular atrophy, no testosterone. So all kinds of effects there. And because of the lack of testosterone, lack of libido. Okay? Just all kinds of issues. And then the ammonia encephalopathy. Right? So that kills. Cholecystitis, so these are gallstones. It's a gallbladder just filled with stones. All right. So the problem is they get out, they block, cause pain, swelling. So nice little gallstone there. You can see a bunch in there. So we have to remove the gallbladder. There's not much we can do other than that. It's more common in females, fat, over 40. I think there was another F. But yeah, diet is a big reason for that. The reason it's more common in females is because of estrogen. Estrogen increases the production of HDL, the good cholesterol. HDL shuttles the bad cholesterol back to your liver to get rid of it. So you're pumping more out and you create these cholesterol gallstones. So that's why you tend to see it in that population more frequently. But diet is really the biggest factor. Pancreatitis. Lots of reasons for pancreatitis. So this is a great memory tool. I get smashed. So idiopathic, we don't know. I've seen a case like that. Girl was 19, I think, or 20, and she had chronic pancreatitis, incredibly painful. Patients will describe it as it feels like someone's taking a drill and drilling through your chest into your back. That is the common pain. Gallstones, because they obstruct the ampulla of water. Okay? Alcohol, ethanol, trauma, so direct trauma. Steroids can trigger it. Mumps, that's why you should vaccinate. Autoimmune disease can trigger it. Scorpion stings, I always thought that was a neat one. Hyperlipidemia, so excess fat, so we're creating a lot of lipase. It starts to eat itself, essentially. And then ERCP, endoscopic retrograde cholangiopancreatography. I got that one. Basically, what's happening here is they go within a scope. There's a gallstone right here. They'll go in with a scope to grab it, and when they do, it just irritates it and sets it off. And then just certain drugs in general can trigger it. Okay? Malignancy. But yeah, I get smashed as a great memory tool. So what's happening is you have the ducts in here. They get obstructed, and the enzymes build up in here, it expands, they destroy it, enzymes leak in. Okay? So they call it saponification of it. And so you can see all the enzymes have eaten it, this yellow spots, and you can see the fat here. That is not normal. So one acute attack of pancreatitis can increase your risk astronomically for developing chronic pancreatitis. The reason I make that statement is one night of binge drinking to celebrate something, and bam, you can land up with chronic pancreatitis. Squamous cell carcinoma of the esophagus, so smoking, drinking in combination, increase the risk astronomically. Okay, so there you go. So if you have a smoker that's having a drink, they for sure are going to have a smoke. So it increases something by like tenfold. And then colon cancer. Any bleeding in the stool must be investigated. Okay? They've lowered the colonoscopy age from 50 to 45. It is, I believe, colon cancer is the #1 preventable cancer, because something as easy as a colonoscopy once every 5 years or 10 years, whatever the scheduling is now, can prevent it. Okay, I want to say it's every 10 years. It's easy. Okay, you drink a bunch of laxative, you poop your brains out for 24 hours, and then you go in, they put you to sleep, they check you, wake you up, they make you fart a bunch, and then you get to go home. Okay. The reason being is they pump air in to inflate the colon so they can pass the camera and so they can see. Okay? But while they're in there, if they see polyps, they just clip them off, and if you catch them early enough, you're done. The problem is when you leave them, they penetrate deeper into the tissue, they get into the bloodstream, metastasize, end of it. Okay? So diet is important. These are bad things. You want high fiber, you want low saturated fat, you want low fat, period. Okay? And veggies are important because veggies are fiber. All right.